Alternative medicines for anxiety. That's what I'm going to be talking about today. I'm Dr. Tracey Marks, a psychiatrist, and on this channel I talk about mental health education and self-improvement. In a previous video, I talked about alternative medicines for depression, and I'll post a link for you in the corner for that one. Today's, though, is about anxiety. Even though there's a lot of medication options to treat anxiety, there are a lot of biases against taking a medication for it.
Ain't nobody here crazy.
And some people will just feel more comfortable taking something over the counter if they're going to take anything at all. So here are 5 options or alternative medications, non-prescription, that are used for anxiety. Number 1, chamomile. Chamomile is a plant from the daisy family, and it has a number of uses. And one is a sedative, which is where it helps with anxiety and sleep, but it's also used as an antispasmodic agent, which assists with digestion and respiratory things like asthma. You can get it as an essential oil to use in aromatherapy, or you can get it as a tea or in pill form. There haven't been a lot of randomized trials for this, and randomized trial is just code for a rigorous scientific study that scientists take seriously. But one scientific study showed benefit for mild to moderate generalized anxiety. The suggested dose is 1,100 milligrams a day. Chamomile is pretty well tolerated without side effects. However, it is derived from a plant family that includes ragweed and chrysanthemums. And these plants commonly cause allergic reactions in people. So those prone to allergies should be cautious because the chamomile could trigger a similar reaction. And some of these reactions can be pretty serious, such as wheezing or chest tightness or even hives. Another issue with chamomile is it contains coumarin, a naturally occurring blood thinning agent that's found in plants. Now, this is not to be confused with Coumadin, which is a synthetically produced blood thinning agent, and it's made from coumarin and other agents. The generic name for coumadin is warfarin, and people will take coumadin to treat blood clots and other blood clotting disorders. It's not expected, though, that regular doses of chamomile will cause bleeding. But if you are someone who is taking blood-thinning agents such as coumadin, aspirin, or even high doses of vitamin E, you should avoid the combination of chamomile along with your other medications because it could cause bleeding problems. Next is Kava. Kava is a plant found in the South Pacific, and it's been used for years to treat anxiety and insomnia. The typical dose for insomnia is 125 to 250 milligrams taken at bedtime. Now here's the ugly of Kava. There's been some case reports of liver toxicity attributed to using Kava, and it's mostly been outside of the United States. Liver injuries include hepatitis, which is inflammation of the liver, cirrhosis of the liver, which is hardening of the liver, and even liver failure. The incidence of liver toxicity are low enough to be considered rare, but the FDA nevertheless has issued warnings about the possibility of this and urge people with pre-existing liver problems to consult their physician before taking any products that contain Kava. In fact, Canada and European countries have banned the use of Kava entirely. Another precaution to keep in mind is that Kava has a lot of drug interactions, so this means it can negatively affect other medications that you're taking. Some people who've taken Kava for months have noticed a slight yellowing of the skin or a scaly rash on their skin. The yellow skin disappears once you stop taking the Kava. So for all of the above reasons, although Kava may be helpful, it's generally not recommended. Next is L-theanine. Theanine is an amino acid, which is a building block for proteins. L-theanine is one form or one version of the bigger theanine that can be found in green tea. Theanine resembles glutamate, which is a neurotransmitter that's important in memory and learning. The research shows that it may help with relaxation, but it's not really robust enough to take care of an anxiety disorder. The recommended dose is 200 to 400 milligrams a day. and that's a lot of tea to drink. But it does come in a pill form as well, and there aren't a lot of reported side effects. So even though it's not really seen as a real heavy hitter when it comes to helping with anxiety, it still may be helpful for general relaxation. Next is valerian. Valerian is a plant that's native to Europe and South Africa. The dietary supplement is made from the plant's root, which is why it's often called valerian root. It works by increasing and blocking the reuptake of the brain chemical gamma-aminobutyric acid, which is also called GABA. Unfortunately, the studies for valerian are extremely limited and poor, and they really haven't shown benefit over placebo. The recommended dose, though, is anywhere between 500 and 1,200 milligrams in divided doses. So that's for the whole day, and then you need to take it between 2 and 3 times a day. So if you're someone who can't really handle or don't want to have to think about taking something multiple times a day, it may not be the supplement for you. The common side effects are headache and diarrhea. Incidentally, I have acquired it in an essential oil form instead of a pill and used it in aromatherapy. I thought it was somewhat relaxing, but it did not smell good. But that is one alternative option for the use of it rather than needing to take the supplement. And lastly, there's GABA. As I mentioned, GABA stands for gamma-aminobutyric acid, and it's an inhibitory neurotransmitter, which means that it's a chemical in the brain that's made by the nerve cells, and it works to inhibit or slow down cell activity. So you can think of it as like putting water on a fire. So in this analogy, the hot fire would be your brain activity, and the GABA would be the water. So in theory, this sounds like the perfect drug to make, but we haven't been able to harness oral GABA that acts the same way that our native GABA does. And part of the problem is that not everything we take by mouth crosses the blood-brain barrier. So here's some serious science here. The blood-brain barrier is a special boundary that separates your brain from the rest of your body. And the brain is very picky about what it's going to let through that barrier. So not everything that you take by mouth actually makes it across that threshold. So we do have drugs, though, that make it across the barrier and activate the GABA receptors. And these would be things like Xanax and Klonopin, which are benzodiazepines. And these drugs act through binding to the GABA receptors once they get past that blood-brain barrier. Binding to the receptors increases GABA. So this is a roundabout way of increasing GABA in the brain without actually taking GABA. So that's it. Out of this list, what would I say is probably your best bet? Based on research, I'd say probably chamomile number 1, L-theanine number 2. Not based on research and just based on what I've heard people tell me, I've seen more people use GABA and chamomile. Mostly in the tea form with the chamomile, like maybe having a warm chamomile tea at bedtime or in the evenings, things like that. Let me know in the comments if you've used any of these and how they've worked for you. And also share this with someone if you think it could help them. Thanks for watching.